The United States spends more per capita on health care than any other nation in the world, but we're far from the healthiest nation. Health insurance reforms are essential to make sure Americans can get the medical care they need. But is there anyone who would rather be sick than well? If we could prevent illness, shouldn't we?
Our comprehensive reform bill lives up to its name by including a robust array of provisions promoting wellness and prevention, jump-starting America's transition into a genuine wellness society. The bill creates a sharp new emphasis on fitness, physical activity, good nutrition, disease prevention, in short, keeping people out of the hospital in the first place. The fact is, as I've said many times over many years, we currently do not have a health care system in America. We have a sick care system.
What we have to do here is take very important prevention steps in this piece of legislation, and I think we're about to do that. Our current system is clearly broken and unsustainable. We really have, as Senator Harkin, this is echoing what he said, a disease management system as opposed to a health care system, or we have a sick care system versus a health care system. 75% of our health care dollars are spent on a few chronic diseases like cancer, diabetes, heart disease, stroke, and a few others. Prevention is really the key. We must get out in front of these diseases. When I talk about disease management, what we're talking about is trying to get out in front of the diseases.
Currently, the United States, as we all know, spends more than $2 trillion per year on sick care. But less than 4 cents out of every dollar is invested in prevention and public health, despite studies showing that disease prevention can effectively reduce health care spending.
The wonderful thing about all of this, as Senator Harkin has emphasized here, is it saves money. It saves money, dramatically saves money. For every dollar invested, many more dollars are saved.
As I said, our aim is to recreate America as a genuine wellness society, a society focused on healthful lifestyles and preventing the chronic diseases that take such a toll on our bodies and on our budgets.
Americans need access to clinical preventive services, such as diabetes screenings for those at risk, and to prevention programs in their communities that help them lead healthy lifestyles. We need safe areas to walk, to run, to ride our bikes, and access to healthy foods and good nutrition. We can start to achieve these things with the passage of meaningful health care reform legislation now.
It's time the nation recognizes that effective prevention is an indispensable tool to improve the well-being of everyone in the country. It's time to put prevention and health back into health care.